So thank you all for attending our AGM, and I'm delighted to present the Chairperson's report for 2023, which I hope you'll agree was a very productive and successful year for Epilepsy Ireland. As you know, Epilepsy Ireland is the national organisation supporting and representing people with epilepsy and their families and carers. We seek to empower all those affected by epilepsy to achieve their full potential by providing high-quality, community-based support and education, raising public awareness, conducting effective advocacy, and supporting epilepsy research. 2023 was the second year of our 2022 to 2026 strategic plan, which guides all we do as an organisation. The plan is centred around 6 strategic aims, and in my report I'll briefly outline some of the key activities and achievements under each of these aims. Strategic Aim 1 is empowering people with epilepsy through support and education. Epilepsy Ireland is dedicated to providing vital support and education services to empower those affected by epilepsy and their families at every stage of their journey. In 2023, our team of community resource officers around the country, our information officer, and the Epilepsy Ireland funded advanced nurse practitioner at Beaumont Hospital responded to a total of 19,975 contacts during the year, a slight increase on 2022. These interactions came through a range of programmes, including individual support sessions, group-based programmes, and specialised initiatives such as the Living Well with Epilepsy programme, which had 233 participants. It also includes attendance at various events and workshops, from the joint Epilepsy Ireland HSE education sessions for adults and parents with new diagnoses, to targeted workshops on topics like employment rights, memory skills, and seizure detection devices. We strive to create a supportive and informative environment for all. One of our goals of our strategic plan is to identify and fill gaps in epilepsy service needs, and this is something we worked hard to develop in 2023. Some of the new programmes offered included Life Balance and Self-Care on Your Journey with Epilepsy, a new support programme delivered over 5 sessions. Teen Time, an online service bringing teenagers with epilepsy together in a safe environment where they can discuss their own personal journey with epilepsy. Monthly Meetups, a new programme for young adults to meet with others of a similar age to discuss their experiences and challenges in a shared learning environment. Workshops for siblings. These workshops for siblings of children with epilepsy provides participants with an opportunity to take part in online fun and games while also addressing challenges and concerns that are particular to siblings within the family dynamic. We also continued our mid-morning mindfulness sessions with Get Charity art workshops for children, 2 very important and innovations introduced in 2022. As you can see, we placed a particular focus on increasing our engagement with young people and children with epilepsy and their family members, something that we are that was particularly highlighted in the development of our strategic plan. We also secured funding from Angelini Pharma to further develop our services with the creation of a young epilepsy programme to be developed and rolled out by a new youth resource officer. This is a major development, and I'm delighted to say that this post has recently been filled. Sadly, 2023 was the final year of training for success, a QQI Level 5 one-year course for young adults with epilepsy at IT Sligo, which had been a fixture of our work for almost 25 years. Although the end of an era, we celebrate the course's profound impact on the lives of many individuals with epilepsy, and we look now to deploying our resources to other ways of meeting the community's needs. Strategic Aim 2 was centering people with epilepsy and their family in the work of Epilepsy Ireland. A key initiative under this aim is the development of a new engagement approach that prioritises the lived experiences of the epilepsy community and planning our work accordingly. In 2023, the Epilepsy Ireland Service Users Consultation Group was established. This comprises of individuals who have used the organisation's services or who have volunteered with Epilepsy Ireland. This group will provide valuable input, feedback, and innovative ideas. This will help Epilepsy Ireland continue to plan and devise programmes in order to meet the needs of the epilepsy community effectively. A comprehensive study was conducted during the year, gathering feedback from individuals who had engaged with Epilepsy Ireland activities over the past 2 years. The overwhelmingly positive responses highlighted the organisation's impact, with 98% of participants willing to recommend Epilepsy Ireland to others with similar needs. The invaluable information gathered throughout will inform our future work plans, and Epilepsy Ireland will carry out the survey annually. Epilepsy Ireland places a strong emphasis on volunteer involvement and recognising volunteers' invaluable contributions to raising awareness, supporting advocacy, and of course fundraising. We're very fortunate to have the support of hundreds of incredible volunteers across the country who are committed to our mission at Epilepsy Ireland, and I want to thank every person who contributed in 2023. In particular, I want to recognise the support of Mark Maguire and Rachel Langan, our Volunteer of the Year Award recipients in 2023, for their exceptional efforts in fundraising and advocacy respectively. I also want to mention our long-standing volunteer, Wayne O'Reilly, who was awarded the prestigious Golden Light Award by the International Bureau for Epilepsy at the International Epilepsy Congress in Dublin. So a thank you to Mark, Rachel and Wayne on all our behalves. Strategic Aim 3, working collaboratively to improve the care of people with epilepsy and knowledge of the condition. Epilepsy Ireland works collaboratively with a wide range of stakeholders, including the HSE and other state bodies, healthcare and educational professionals, the medical and scientific community, and other non-profit organisations to improve the care of people with epilepsy and to increase the knowledge of the condition. Our key partner is the HSE, with whom we have service level agreements funding our core support services across the country. We also collaborate with the HSE Epilepsy Services on projects such as joint education sessions, an excellent model of collaboration, which delivers an effective early intervention for people coming to terms with an early diagnosis. We also do so through our long-term funding the role of a registered advanced nurse practitioner for women with epilepsy based at Beaumont Hospital. The most significant and exciting collaboration of 2023 was the International Epilepsy Congress held in Dublin in September, attended by over 3,000 international healthcare and scientific professionals. The event is organised every 2 years by the International Bureau for Epilepsy and International League Against Epilepsy. One of our goals as organising partners was to increase patient and public awareness in the event. We hosted 2 sessions for people with epilepsy and their families, featuring global experts presenting in non-scientific language. Events drew nearly 700 in-person and online attendees over 2 nights. A very proud moment was when Epilepsy Ireland's contributions, both to the organisation of this event and to epilepsy care in Ireland over many years, were recognised by An Taoiseach in his opening address to an auditorium full of on epilepsy. Our training programme on epilepsy awareness and the administration of buccal is another important example of helping to improve the care of people with epilepsy and knowledge of the condition within the wider community. The BM course is aimed at healthcare workers, care professionals, educators and others. The programme educates participants in epilepsy, emergency medication and the correct administration of BM. 2,791 professionals were trained in 2023 across 214 training days. Epilepsy awareness training was delivered in educational settings with 3,731 attendees in 152 sessions. Supporting and funding research is another way we actively aim to meet the strategic goal. 8 funded projects were ongoing during 2023, including a newly initiated project led by RCSI. This project is focusing on identifying the health information needs of women with epilepsy from preconception to postpartum. The project is co-funded with the Health Research Board and the HSE's National Women and Infants Health Programme. Other ongoing Epilepsy Ireland funded projects are investigating potential biomarkers in autoimmune encephalitis, temporal lobe epilepsy, CDKL5 deficiency disorder, and Dravet syndrome, as well as studies looking at the efficacy of seizure monitoring devices and SUDEP incidents. These projects are underway at RCSI, Future Neuro, and UCD. Due to the record number of ongoing projects and the financial commitments associated with them, no other projects were funded in 2023, although we did collaborate on a number of projects in a non-financial way. Strategic Aim 4, transferring preconceptions of epilepsy and public policy relevant to the condition. 2023 was a particularly positive year on this front with several awareness raising and advocacy campaigns. We utilised various strategies such as International Epilepsy Day in February to increase awareness of seizure first aid with keywords time, safe, stay to the fore. In September, our public awareness campaign posed the question, if I fall down, will you stand up? The eye-catching visual campaign, supported by the National Transport Authority, featuring 2 Epilepsy Ireland volunteers, and again aimed to inform the public on how to respond to seizures. Other efforts throughout the year included National Epilepsy Week and activities for Infantile Spasms Awareness Week and SUDEP Action Day. We also achieved several significant advocacy milestones in 2023. It was announced last October that from July 2024, people who are medically unfit to drive for at least a year will be able to apply for the free travel scheme. The announcement came in budget 2024 and followed continued advocacy over many years by Epilepsy Ireland. I'm delighted to report that the scheme is going ahead as promised and applications are now open. So if you're entitled, please do put in your application. Improved reasonable accommodations for students sitting a leaving certificate has been another long-running advocacy issue for us. In 2022, deferred exams were introduced for medical conditions, including epilepsy, but not applied if you had a seizure before the start of the exam. After further exchanges by Epilepsy Ireland with the State Examinations Commission and the Minister of Education, deferred eligibility was expanded for 2023 to include students who experienced medical emergencies, including seizures, during their exams. This is a very welcome development and alleviates what, for decades, was an unnecessary worry at exam time and had previously left many students repeating their leaving certificate. Working with our colleagues in Oaks, Ireland, we also secured government approval to formally establish an inquiry into the historical licensing and prescribing of sodium valproate. This campaign lasted for over a decade, but with terms of reference agreed for the inquiry and the Department of Health in the process of recruiting a chairperson, we look forward to the long-awaited inquiry being up and running very, very soon. Strategic Aim 5 is increase and diversify income. Following 3 difficult years for fundraising due to COVID, 2023 was a successful year financially. Our Treasurer, Paul Keogh, will discuss this in more detail shortly. I, however, want to put on record my thanks to all our donors, volunteers and funders who helped support our work during the year. It goes without saying that many programmes and events would not have been possible without this support. Strategic Aim 6 demonstrates highest standards of governance and ensure structures are in place to meet objectives. At Epilepsy Ireland, we understand the importance of maintaining the highest standards of corporate governance. Not only is this the key enabler in delivering our mission, but it is vital in maintaining the trust and confidence of members, service users, volunteers, funders and donors. We hold the Charities Institute Ireland Triple Lock Best Practice Standard, which we retained in 2023. This means we have fully implemented the Charities Regulator Governance Code. We comply with the guidelines for charitable organisations and fundraising from the public, and we prepare our annual accounts in compliance with the Charities SORP accounting standard. We also maintained the Improving Quality Foundation Quality Mark, a quality standard developed for small non-profit organisations. First gained in 2021 for a 3-year period, We plan for a new IQ accreditation later this year. The board met 7 times in 2023, and some of the good governance work undertaken included monitoring progress at each meeting against the agreed 2023 operational plan and budget, reviewed and agreed changes and movements in Epilepsy Ireland's designated reserves, decision taken to discontinue training for success at IT Sligo, reviewed and approved updates to almost 20 internal policies and procedures, approval and monitoring of operational plans and budgets, renewed and approved proposals on staff salaries with reference to both available benchmarking and resources. This is just a taste of the variety of issues on the board agenda and the work of the board subcommittees. Our board is comprised of 14 volunteer members drawn from a variety of backgrounds, experiences and skills. 5 new members were appointed in 2023, prioritising identified gaps in the board's collective skills and experiences, including legal, financial and communications. A new research subcommittee was set up during the year to advise the board on research investments and related matters. We're very fortunate to have such committed, skilled and engaged board, and one that is constantly looking to improve what we do and how we do it. I want to thank all my fellow directors for their dedication, enthusiasm and their support during the year. I'd like to say a personal word of thanks to our Treasurer, Paul Keogh, and to our Secretary, Claire O'Dea, for their wise counsel, availability and constant support. It has been quite a challenge to condense Epilepsy Ireland's entire year into a short report, and I'm very conscious that a significant aspect of our work has not been mentioned. There's considerably more information on both our accounts and our annual report available on our website, and I'd ask you all to please do take a look. All of this work speaks volumes about the dedication and the productivity of our staff team, which consists of just 25 people, many of whom are part-time. I want to thank all of the team in whatever role they play, and in particular I want to thank our dedicated CEO Peter Murphy and everyone for their outstanding work in 2023, which despite all the challenges faced was one of the most successful years in recent times. Finally, but most importantly, I thank everyone who contributed to Epilepsy Ireland's work in 2023. Together, we strive towards a society where no person's life is limited by epilepsy. Thank you very much.